I'm Robin. I'm the speech-language pathologist here at Placenta, and we are here to talk about dysphagia. Yeah, so dysphagia is a fancy word for swallowing difficulty. A lot of times our patients come in complaining of food getting stuck in their throat, the sensation of choking, liquids going down the wrong pipe. It can be many different things, but those are usually the most common complaints. Yeah, so there are three primary phases of the swallow. There's oral, which is mouth, pharyngeal, which is throat, and then esophageal, which is that pipe that leads from your throat to your stomach. So the oral phase of the swallow, that's your ability to close your lips to keep your food and liquids in your mouth, chewing up your food, moving your food and liquids around your mouth. The pharyngeal part of the swallow essentially starts once the food and liquid or whatever it is you're swallowing hits your throat. This is where the involuntary control takes over. So this is where that fine orchestra of muscle movement kicks in. The back of your tongue retracts, the muscles contract, your airway closes off, and this little slit in your throat kind of opens up to allow whatever it is you're swallowing to pass through. That leads us to the esophageal phase. Essentially what happens in the esophageal phase is a wave, like a peristaltic wave kicks in. Gravity also takes control and it allows the food, liquid, medication, saliva to pass through and it ends up in your stomach. So it can be caused by different neurological disorders such as multiple sclerosis, muscular dystrophy, Parkinson's. It can also be caused by any sort of neurological damage or insult or injury, such as stroke, brain injuries, spinal cord injuries, things like that. Another common cause of dysphagia is certain types of head and neck cancers, especially brain cancers. Also, cancer treatment can cause dysphagia as well. Other causes could be reflux, so GERD, COPD, and then also just general aging. So as we get older, our swallow can be impacted as well. A lot of times it can impact quality of life quite a bit. So you think of how social it is for us to be able to eat and drink with others. So we want to kind of get patients in, get them the care that they need so that we can help their quality of life, make sure they're enjoying the things that they want to do. Another big thing is so they don't experience weight loss or worsening of their swallow function, depending on what's going on. Another big component, a possible complication of dysphagia could be something called aspiration pneumonia. So anytime you hear someone say, I feel like it's going down the wrong pipe, they're probably referencing aspiration. So a complication of food and liquid ending up in your lungs would be pneumonia, which is a lung infection. So another big reason to seek care and treatment for your dysphagia. Dysphagia usually doesn't just occur on its own. It recurs as a result or a symptom of something else. So we kind of work to figure out what is this underlying issue and then refer you out to the right providers. So we offer a lot of different services here as far as assessment, management. So first, we're going to diagnose. So we want to get you into the office. Speech pathologists can do quite a few different tests to assess for dysphagia or swallowing impairment. The one that we do here is called Flexible Endoscopic Evaluation of Swallow, which is FEES for short, much easier to say, FEES. So this test, pretty simple, straightforward. We pass a small scope through your nose and we just watch you swallow. From there, once we figure out what's going on, then we set you up with a treatment program. So we have you come in, again, do either exercises, strategies, anything like that that's tailored to your specific needs in order to help you either regain your swallow function or compensate for the difficulty that you're having. We take a team approach here. So we have our team of PAs and ENTs. So if there's anything as far as further medical management that we think that patients would benefit from, then we make sure we get you guys to the help that you need. So the treatment options, we do traditional dysphagia therapy with exercises. We recommend compensatory strategies, postural changes, and in some instances we do recommend diet texture modification to make swallow a bit easier for patients. So since dysphagia usually impacts the older population, we get a lot of questions as far as how can I help my loved one with their dysphagia. So I would say the first thing is just getting them in for an assessment. Everybody's different. There's many muscles involved. So we want to figure out exactly what's the part that's not quite working right so that we can figure out exercises or strategies in order to help them. Generally speaking, I think a good rule of thumb is just to make sure that your loved one is eating slowly, taking small bites and sips. If they feel like food's getting stuck in their throat, they can perhaps wash it down with a sip of water or an extra swallow, things like that. But again, the most important thing is getting them in for an evaluation assessment, because we want to know exactly what's going on so that we can treat it.